everyone. Welcome back to another segment of Soul Talks with Alka. Today, we're going to be talking about diabetes. Diabetes affects about 15 million women in the United States. That's 1 out of every 9 women. So, most of us have about 10 close friends. So, you can imagine 1 out of every 9 women has diabetes. With that, I'm going to welcome my next guest, Anne Saffrendale. And Anne, welcome.
Thank you. I am so excited to be here today.
I am so excited to have you. You're like a powerhouse. You're a role model to so many women. You're a role model to me. So I'm
Aw.
extremely excited to have you here.
Well, thank you. It's my goal to share what I've learned with others so that maybe they don't have to go through what I've gone through, or they can help family members. So it kind of covers everything.
Absolutely. So, Anne, tell us how your journey began. Tell us a little bit about yourself and a little bit about when your diabetes was detected and when your life changed a little.
It changed a lot.
Yes.
And it didn't really start with being diagnosed with type 2 diabetes. Diabetes affects your health in many ways. And what I have learned is that quite often being diagnosed with this, you can have heart disease show up and not know that you have type 2 diabetes.
Yes.
And so back in 2001, I was going through a lot of stress, very stressful job. My eating was out of control. All kinds of factors played into it. And I wound up having a mild heart attack.
Ooh.
Exactly. And my father had heart issues, but it's one of these things that you think, it'll never affect me. That won't happen. I'm young. I was 48 going on 49 years old. And
Wow.
I was running nonstop. So how could something like this happen to me? But it did. And thankfully, it was mild. They put in a couple of stents, and I seemed fine and dandy. And then a couple of years later, I think it was, I was at work one day, and I'm sitting at my desk, and there was a window in front of me. And I'm looking outside, and I'm thinking, things look a little odd.
Ooh.
So I went like this, and then I went like this, and then I went like this again, and I realized something was wrong with one of my eyes.
Oh boy.
And that's a sign of high blood sugars or high blood pressure.
And one of the side effects of diabetes.
Well, but when you don't know you have it at that point, I mean, that's what comes later.
Yeah.
And so all these things are playing around with my health, and I'm not aware of it until I went to the eye doctor the next day, because I thought, this is very odd. And so when I got to the eye doctor, he said, "Oh, do you have type 2 diabetes?" I said, "I don't think so." I had told him about the heart attack, and I said, "No, I don't think so." Because I didn't
Did you go for a regular exam, like a
Yes.
physical every year?
Yes, but it was more heart related. And so the eye doctor sent me the next day for something called a glucose tolerance test. I don't know if they do it anymore, but you drink this sickly sweet liquid, and they test your blood every certain amount of time. And test came back, said, "You've got prediabetes." I went, "Well, I guess I do." And so that's where the journey started. But in those days, and at least in my circumstance, no one put the health issues together. No one said, if you have type 2 diabetes, you might have heart issues. If you have heart issues, you should go see an endocrinologist, because these two things go together. But this was 18 years ago, I guess.
Yeah. So no one connected the
And
dots
so
for you.
no one said anything. And I went to a dietitian. And back then, things were very different also. And she put me on a diet, or said to change your eating this way. And my numbers got worse.
Oh, really?
They got worse.
After watching your diet?
The way that she instructed me to. So it was basically a learning experience for me to go do my own homework and figure out what's going on here. But at the same time, again, I felt fine. It's invisible, so it's easy to put on the back shelf and forget about.
Yeah.
And so when I went back, I don't know how long after that, and I had blood tests done, it had changed to full-blown type 2 diabetes.
Wow.
So that was a wake-up call, and I did more homework. and found that the foods that I was eating affected my health greatly. That eating high carbohydrates would raise my blood sugars. And back then, the food pyramid that we always used would say, have 6 to 8 servings of grains and breads a day.
Yeah.
Well, that was not something that I should have been doing.
Yeah, that's not what you should have been having.
Exactly. And actually for most people, because with the numbers that you mentioned of how many people are, having this happen, it affects everybody. So when I learned that that wasn't something I should be doing, I was again searching for ways to change things. And I went on to a site called Meetup, where there is every type of group for any type of thing that you're looking for. So I was looking for a place that might be able to instruct me on how to eat better for dealing with type 2 diabetes.
Or how to manage yourself better.
Everything.
Yeah.
Everything. And so I found a place in Princeton. And the group is called the Suppers Programs.
Nice.
And the idea is that people get together. There's a leader for the evening. And you cook together. And you learn how to help your health issues get better. And so it's
through food,
and managing different things that go along with it, whether it's stress or anything else. And through going to the Suppers Programs in Princeton, I met other people that were part of a group called Diabetes Sisters. And that's become a huge part of my life.
Very nice.
Because it's a peer support group for women.
Very nice.
We get together monthly, and they're in half the countries in the U.S. already. Some states have multiple meetings going on, and you meet for a couple of hours. There's a topic generally for the evening, but we take turns going around the table at the beginning of the meeting, sharing what's pertinent in our life at the moment.
Wow. So what do you talk about?
We talk about everything that affects women when it comes to having type 1 diabetes, type 2 diabetes. There's another that's called type 1.5, which is a later adult onset diabetes, which is closer to a type 1 needing insulin. So we discuss everything having to do with it. People that have type 1 diabetes discuss how they handle their insulin and pumps and things that are a part of that. People with type 2 talk about, some of them are on insulin if their sugars are not under control. And we just discuss all these things, whether it's how to control our A1C, which is the 3-month blood test to see how your body is doing and reacting to your blood sugar levels, moving up and down. It tells you how things are. So,
but while this is happening,
yes,
your life is happening too, right?
Oh, yes.
Your daughter's getting married. You have all this exciting stuff happening in your life.
Moving into a new home.
You're moving into a new home. How are you controlling the stress, the eating habits at that time, right? Because when there's a wedding in the family, when there's happy life events, food is how everybody connects, right?
Oh, 100%.
So how are you doing that in managing food and life and stress?
Well, I managed life pretty well because I like to be on the go. So that energizes me. And I helped my daughter with the wedding because having been an event planner for so long, that was my passion. So I was happy to be involved with that. But at the same time, I wasn't controlling my food as well. And even though I was going to the Suppers Programs, I was on and off with the way I should be eating. And another issue popped up along the way through all my tests. And I do go for my blood test every 3 months or whichever doctor is asking me to go have tests. And we found out that I had kidney issues. And of course, that surprised me because, again, I felt fine. I was, and again, very silent. And it winds up that there were a number of things that played into it. The dyes that they used when I had catheterizations in my heart, we didn't know I was allergic to it.
Oh boy.
And that affected my kidneys. I had a kidney stone that decided to embed itself in my kidney. That put me further into kidney failure until it was removed. But by then I had kidney damage. And so with my sugars not controlled as well as they should have been, and these other circumstances, I continued to have my kidney decline.
Oh.
And so then I had another shock where they said, it's at a level where we think that you should put yourself on the kidney transplant list.
Oh boy.
Oh boy is right. And that throws you for a loop.
Yes.
And again, I'm feeling fine.
Yeah.
So how could that be? I mean, I would get tired, but I'd say I was tired because I was running into New York or going and doing things like I do
you
all the
wouldn't
time.
even think about it.
I didn't.
Yeah.
I didn't. But
Yeah.
I have an amazing nephrologist, and very, very aware of what I needed, what I should do personally, not just in general. And so he was very attentive, helped me greatly, and especially with having to put myself on the transplant list. And then at a certain point he said, you may need to go for dialysis.
Oh boy.
And so at that point,
now you're like, what the hell?
I'm at a point where how could this be?
Yeah.
And I even went to a dialysis center to be trained in what to do. But in the meantime, something amazing happened. Because I was told you might want to look for a donor. And I'm thinking, I don't know how to ask someone to say, may I have your kidney? So somebody, I guess at the hospital, had said to me, well, children, relatives, and my daughter would love to have donated, but she's got some health issues which prevent that. And so I said, let me ask my son Josh. And I wasn't sure the reaction, because that's a big ask for a parent to ask their, even though he's an adult child, to ask. I think it took him 10 seconds. And he said, oh yeah, okay, I'll do that. He went online, registered with St. Barnabas Hospital to be a live donor.
Wow.
And that's when things started to move along. We had quite a while in between with testing, because they do extensive testing.
Right, of course.
Extensive, because this is major.
Exactly. It's not
major.
A little thing.
Exactly. And so I'm trying to think. It was January of this year. I had a kidney transplant. Josh's health was where it should be, what they asked him to do. He did. And then they called and said,
awesome.
They said, can you come in January 22nd? And I'm thinking, I have a lot of things to do. And I went, wait a minute. No, you don't. You have to go in and have a kidney transplant.
And you got to stop life for 2 seconds here. You got to do this for yourself.
When you're on fast forward,
yeah,
this means you're going to stop for a little while.
Yes.
And so I had the surgery, and he obviously had the best kidney on the planet, because it started functioning within that day.
Nice.
I mean, there were some complications afterwards that we took care of, and I got through, and Josh is healthy. He's back working. And I became more involved with the National Kidney Foundation.
Oh, wow.
And actually, to go back a little bit, my nephrologist and I took part in a Facebook Live event for the National Kidney Foundation. And what was great is because it was my own nephrologist, my kidney doctor, talking to me. And that's still online.
Nice.
It's still available. It's still out there. And that was about a year before my surgery.
So you become a spokesperson for every event that happens to you. So when you have a kidney issue, you go on Facebook Live with your nephrologist.
Yes.
And you make that an event. When you have diabetes, you go on TV and you talk about that.
Well, I did. I was part of a program before the transplant. One of the pharmaceuticals wanted people to understand the importance of connecting heart disease and type 2 diabetes. And many doctors don't talk to their patients when they're diagnosed with one to suggest to look into the other. So I became a spokesperson for something called For Your Sweetheart. And so through that program, I went on the Dr. Oz show. I did do the Rachel Ray show. They came to my home.
See?
And I baked a sugar-free, flour-free cake that someone with diabetes could eat and not have their blood sugars go up. And that's still floating out there on the internet as well.
You're like a celebrity. I didn't realize you were a celebrity, but you're a celebrity.
I'm
You
a-
just become
It's
a spokesperson for whatever's happening in your life.
And I think part of my recovery is doing that, to keep myself focused. I've learned a lot. I've learned an amazing amount of information. And after doing the Facebook Live with my nephrologist, the National Kidney Foundation invited me back again to moderate a panel.
Wow.
And I thought, it's one thing to have someone ask me questions. I know the answers. But it's another to moderate a panel where there is a cardiologist, a nephrologist, a dietitian, an endocrinologist, whatever, medical professionals, high-ranking, impressive people. And the Kidney Foundation assured me, we think you should try it. And I have to say, after getting to the studio and running through it, I went, I think this is going to be fun. So I've since done another one.
Wow.
And it's great when you go online and see, 97,000 people have watched this.
That's
It's
awesome.
just amazing, which means people are learning.
Yes.
They're listening and they want more information.
Yes.
And so if I can do that and help them, then I'm happy.
So what motivates you to become so positive through all of this? You don't go, you're not downtrodden by, oh my God, I have a heart issue, I have a kidney issue, I have diabetes. You're not doing that. You're like, how can I go out and help? How can I make a difference to somebody else's life? So what is it that lights your fire?
The thought that I can share what I know, that I can help somebody that might not necessarily be aware of the things that I've learned after all these years. And there are people that are diagnosed with type 2 diabetes and their doctors will say, we want you to go home and test your blood sugar and eat healthy. What does that mean?
Yeah.
Because doctors generally don't have a lot of time to spend with their patients.
Yeah.
I mean, I have a general practitioner who does. I have a nephrologist and an endocrinologist who take the time during your appointment to speak to you, to listen to you. So it's more of a partnership.
Mm-hmm.
And so not everybody has that.
Yeah.
They don't have that. So that's why Diabetes Sisters is so important.
Yeah.
We have doctors referring their patients, their women patients, their female patients, to the group.
Nice.
So that they can have connections with somebody else that has the same health issue.
And so if you just Google Diabetes Sisters, that's what you get?
Yes, and hopefully we can provide the website for that because it's in at least, I'm trying to think, 30-something states around the country. We're growing very quickly.
It's great to have a support system like that
Mm-hmm.
where women can go out and learn a little bit more about
And we need to.
diabetes and how it affects them and what it can do, because blindness, kidney disease, heart disease, these are all very common effects of diabetes.
And the other thing is when someone's diagnosed with any of these issues, but type 2 diabetes, you kind of go into yourself and go into a state of denial.
Yes.
And so when you finally face what you've got, you have to do homework and figure out, how am I not going to have eye issues? Yes. There's retinopathy. Yes. There's neuropathy. It affects your limbs, Absolutely. Your circulatory system. It affects your kidney. It affects your entire body.
It affects your entire body.
Yes, because it's your body is reacting in a way that it's trying to protect itself.
Yes.
And how can it if your blood sugars are out of control?
So what do you do do you eat everything that's very so are you still on medicine for diabetes now?
I've been taken off my medication.
Oh, very nice.
Yes. And after my surgery, I was on quite a bit because your numbers are a little bit wacky and they have to get it under control. And so I brought my A1C down, and that's the 3-month test to see how your blood sugars, your body's reacting. And I'm down to a 4.8, which I was told if a new doctor looked at my blood test, they wouldn't know that I had type 2 diabetes.
Wow.
But I've been working very hard, especially this year since the kidney transplant, because I feel like I've got to protect this. I was given the greatest gift imaginable, and high blood sugars affect the kidney, so I don't want to have to deal with that.
Yeah.
So I look at food as my medicine, because that means that if I'm eating correctly, dosing myself properly, cutting my carbohydrates, which is really what controls how your blood sugars go up and down, how they go up and down. And so I've resigned myself to saying, what's more important? Is it important to eat a slice of pizza or have ice cream or be healthy? I've eaten ice cream for many years, so I know, it's not as if I've never had it before.
Yeah.
And that's not to say that I don't have a taste of something once in a while, but I don't eat it the way I used to. And I love to cook. And so I'm online with different Facebook groups and also with, Diabetes Sisters. We sometimes bring in things to share, recipes or whatever.
Yeah.
And I even started my own meetup group.
Look at you. Look at you.
Well, I did this for a selfish reason. I wanted to get together with other people who have some of the same issues, that have to deal with knowing what kind of foods to eat and not eat. And so, I started this meetup group, and we had one meeting where we met for lunch, and it was amazing. We had 8 people show up the first time, which was exciting.
That's great.
And everybody talked about how they eat, what they do, what works best for them, what books they've read that they thought others could take advantage of reading to help themselves.
There's so many people out there to help everyone. If you take the initiative, there's so many people who are there. I mean, you're here because when I spoke to you, you said, if I can help someone, I want to help someone.
Yes.
And that's how you just have to go out and find and be one of those people who are either helping or say, you know what, I want to help.
Exactly.
And you'll find plenty of people who will give you company.
It's like a whole new tribe of people that get together, and we form almost like a family.
Yeah, but nothing stops you though. You go out to plays, you're going out to movies, you're going out to doing all these things. You never just sit home and brood and cry and nothing like that. You're just an outgoing person.
It's not my nature. I mean, of course, when I wasn't doing well, there were some tears because
you're human.
Exactly. Yeah. It affects you. And so the other side of it is, when I'm feeling well, this is who I am. And it's my nature to want to go out and share things with people, and things that I've learned that sometimes I find very exciting because I had no idea, and not necessarily in a positive way. Because when I learned about the connection between type 2 diabetes and heart disease and how they go hand in hand, and I've learned since that many times people that wind up in the hospital with a heart attack have had some level of diabetes before that even happened, but it's not as if anybody knew or connected the two. Yeah. So like I said, this is my goal, to share this information with others.
So if you had to give a couple of tips to women,
right,
and say, you know what, obviously I think your number one key is your positive attitude and your wonderful personality, right? Because I think your positive attitude is huge.
It helps greatly.
Yeah, because you come out and find a solution for every problem instead of finding a problem for every solution.
Right, you do your best.
You do your best.
You get further in life if you do that.
Yes, but what else would you recommend women who have been diagnosed with diabetes and women who have not been diagnosed with diabetes?
Right, and specifically type 2.
Yes.
Because type 1 is an autoimmune disease.
Right.
And that's much different than type 2. So when it comes to having type 2 diabetes, I think being proactive is number one. Get as much information as you can. Yes. Get up-to-date information. Yeah. If you're not happy with your doctor because they're not listening to you, find a new doctor. Yeah. Because again, we've had women show up at our Diabetes Sisters meeting and they're basically floating. They don't know which direction to go. And it's because their doctors were not... I remember someone coming to the meeting saying, regarding her diabetes, saying, well, I'm really not that aware of the disease as much as I should be. And as soon as you hear that, it's like, I think I need to find another doctor.
Yeah.
So that's where you have to be proactive. Talk to friends, talk to other doctors, find somebody. Yeah. Find a doctor that you can work with. Go to this Diabetes
Sisters
Absolutely.
Foundation. Go get help.
Yeah. Diabetes Sisters is a great way to learn more, and it's a resource.
Yeah.
As a matter of fact, our website is spectacular. We have interviews with people who have gone through this. We work with every different community, whether it's Asian, whether it's Southeast Asian, whether it's the Hispanic community, whether it's African American.
Wow.
We have people from all these different groups that are there talking about their own experience.
Yeah, diabetes doesn't care.
Diabetes doesn't care. It hits everybody.
It hits everybody.
But culturally, what we eat is very different quite
Yes.
often.
Yes.
And I attended a program earlier in the year. It was a Diabetes Sisters meeting, and it's predominantly Southeast Asian. They brought in not only was she a dietitian and a cookbook author, but she was Southeast Asian. So when she spoke to the audience, they related to her, and she was talking about, because rice is very important.
Yeah.
And she was saying how she uses cauliflower rice to replace things.
Yeah.
And so she was able to speak directly to them. And the same thing for the Hispanic community, the Latin community. Everybody's background eats differently, and quite often there are things that are traditionally part of your cuisine that can exacerbate things. And how do you work with it? Do you give it up completely?
Yeah.
Do you say, I'm never going to eat that again? Or do you say, I have to learn how to work that into my way of eating so that my blood sugars are controlled? Am I going to wait till a holiday to treat myself for something special?
Yeah.
So you have to work your way through it.
Absolutely.
And everyone's got likes and dislikes.
Yeah.
So it's a learning curve. And the website for Diabetes Sisters, and also if you go to the suppers programs, it's suppersprograms.org, they must have, I would say, 2,000 recipes. You can look it up by a certain ingredient. You can look it up by a type of recipe. It's broken down for different health issues. So there are resources out there that are amazing.
Yeah.
And
You have to also look for them. There's a ton
Yes.
of knowledge or information out there.
Yes.
You have to look for them. But the key thing is having that attitude, right? Is to go out and saying, you know what, I'm going to get the information that's out there and help me. Because part of it is you can only help someone who wants to help themselves.
Yes.
Right?
And sometimes that's difficult.
That is
They're not
difficult.
ready.
So what is it that you would give that as motivation? For someone to say, you know what, do it. Just get up and get yourself the information.
Well, again, it's a matter of having people that are there to support you and to look for those people.
Yes.
It can be very lonely if you're the only one in your family dealing with type 2 diabetes.
Yeah.
They don't understand. They don't understand why you're not going to eat pizza or have that sandwich, but grandma made this cake for you.
Yeah.
That cake can kill me.
Yeah. I can't eat that cake.
I shouldn't. Or I know people that will take it and smile, and then they'll walk into the other room and say, would you like this? So no one knows.
Yes.
I mean, it's one of these things you have to think of yourself first. And at the same time, some people aren't ready to do that.
Yeah.
So for people that aren't really motivated, even though they've got type 2 diabetes, let's say they've moved from pre-diabetes to type 2, that they need to look inside themselves at a certain point and say, I'll mention this, the number of people having amputations is growing in the United States.
Yes.
You know, it's one of these things because it affects your circulation.
Yeah.
And so I know I don't want that.
Yeah.
I don't think anybody else wants that. But you have to psych yourself into saying, what I'm doing matters. It matters to me. It matters to my family.
Yeah.
And what's more important? Is having the pizza, ice cream, cookies and candy more important than living a good life?
Yeah.
And
so
so
living a healthy life.
Oh, yeah.
As healthy as can be, right?
Right.
And diabetes is something that you don't feel anything.
You don't.
You can't see anything, but it can kill you. To sound very extreme, because it works on your function. So you have to take care of yourself.
Exactly.
Yeah.
Exactly. And if you don't, the consequences are dire.
Yes.
Are dire. But if you do,
Yes.
you can turn it around. You can have an amazing life.
Yeah.
You can keep going to see shows and movies, and going out with friends and doing everything and anything, going on a hike with your neighbors.
Yes.
And if you don't like to exercise, which many people don't, you walk.
Yeah.
A lot of people just walk a little further sometimes.
Yeah.
And then you get into the place where, you know something, I enjoy being outside and walking.
Yeah.
So you find positive things along the way that'll help reinforce the things you need to do.
And you help others along the way.
Oh, yes. And if you or anybody starts making changes, they'll want to share it as well.
Yeah.
And that's what we do, like I said, at Diabetes Sisters. We share with each other. We support each other.
Awesome support group.
Yes, and I can't say their names enough, say the name enough, because that's been a lifesaver for me.
Yeah.
And with the National Kidney Foundation, they're helping me to improve everything about myself because I'm learning so much from them, and in turn, I can go out and help others. So all these things really do fit together.
Yes. So if you or someone you know has diabetes or is having issues that maybe the dots haven't been connected yet,
Right.
First, go to the doctor, get a checkup, get your A1C tested, right? Make sure your blood is tested. And if you're not comfortable with your doctor, go to another doctor.
Yes. There are lots of great doctors out there.
There's a lot of great doctors out there. Then maybe get some information on what diet is working for you, what diet is good for you, because food is
my medicine.
Your medicine. And majority of the people, they say most of the medicine is in the kitchen. So sometimes a lack thereof, right? Because if we don't eat a lot of that stuff. And find yourself a support group. So if you know of someone who has diabetes and can get in touch with the Diabetes Sisters, have them talk to them. Find someone who can help, who can support your family member and make their life easier, make their life a little bit more supported.
Exactly. And family support is so important.
Yeah.
It really is. Not just family and friends, relatives.
Yes.
It's everything is connected.
And most is positive outlook. If you can help someone, if you can just make yourself better and then go out and help someone else, I think that itself is the number one healer, I think, because it starts your road to recovery.
Exactly. Attitude. And a positive attitude goes a long way.
Yes.
Very long way.
Very long way.
Yes.
And with that, Anne, we would like to thank you for joining us
on pleasure.
Soul Talks with Alka. If you thought this episode was helpful, please like it, please share it, and please subscribe to our channel. Again, thank you for joining Soul Talks with Alka.